Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about atrial fibrillation.
Atrial fibrillation is a very common occurrence. It is a disturbance of the heart rhythm, and there are about 8 million people in this country who have atrial fibrillation. Now, atrial fibrillation simply means that instead of your heart beating 1, 2, 3, 4, 5, just in sequence like that, in a very organized way, the heart starts beating in a very disrupted way so that it beats more quickly and irregularly, and that decreases your heart output. And the main risk here is that it can also lead to strokes. So atrial fibrillation is common. It has the risk of causing strokes because clots can form on this valve that's not beating in synchrony and is beating quickly. And then lastly, it doesn't get better on its own very often. Now, people can go in and out of atrial fibrillation, but ultimately it becomes more frequent. It becomes more bothersome. It affects the heart function more. And then something has to be done, either a shock to the heart, which can get the heart rhythm back to normal, or sometimes something called an ablation, where you go in and actually destroy the area that's causing the atrial fibrillation.
So if I had a friend or a loved one who is diagnosed with AFib, what would be some of your recommendations of the questions to ask your doctor?
One thing that is very important is, do you know when you're in atrial fibrillation? Do you have a feeling of how often you're getting it? What other things are occurring? Are you short-winded with it? Do you feel like you're going to pass out? Do you have chest pain? What medicines can you take? That's a very important question because you start out treating this disorder usually with medications. There are certain kind of meds you can give that will decrease the incidence of atrial fibrillation and sometimes shorten the period of atrial fibrillation. But over time, these medicines will lose their effectiveness, and then you need something else. Now, in an emergency or urgent situation, a shock to the heart will get the heart back to normal. Now, long term, you also have this big worry about, can I get a stroke out of this? Is this going to result in something more severe? So drugs like aspirin, warfarin, blood thinners help keep the valve clean. It helps keep these kinds of clots from forming on the valve that can eventually cause a stroke. Now, as time progresses, this can become a very serious problem. If you don't go back to a normal rhythm and stay in it over a period of time, or if you're just always in atrial fibrillation, it very much decreases your exercise capacity, maybe about 40%. And if you cardiovert, in other words, shock the patient back to normal, and then you start having to do that frequently, then you have to look beyond that to something like this procedure called ablation. Because you've already tried medications, you've tried the shocking of the heart to get it back to normal, nothing is lasting, and the heart output is decreased about 35% when you're in atrial fib. It's very, very significant.
Thank you, doctor, and thank you for watching. Be sure to go to hearthealthcommunity.com to learn more about AFib and to join our AFib group. Thank you.